Hey there, it's therapy and relaxation. Today, we're talking about leveraging AI in healthcare. Let's go! Artificial intelligence is rapidly transforming the healthcare landscape, offering breakthroughs that once seemed impossible. From diagnosing diseases with remarkable accuracy to personalizing treatment plans tailored to individual patients, AI's promise in medicine is immense. Yet, as this technology advances, it brings with it a host of ethical questions that must be addressed to ensure its responsible and equitable use. At the heart of AI's appeal in healthcare lies its ability to analyze vast amounts of data quickly and efficiently. Algorithms can sift through thousands of medical images, lab results, and patient histories, often identifying patterns or anomalies that might escape even the most experienced clinicians. This analytical prowess can lead to earlier and more accurate diagnoses, potentially saving lives and reducing the burden on healthcare professionals. Furthermore, AI-driven tools can help predict which patients are at higher risk for certain conditions, allowing for preventative measures or targeted interventions. Yet, with great power comes great responsibility. The use of AI in diagnosis and treatment raises critical questions about the reliability and transparency of these systems. If an algorithm makes a recommendation, how can patients and doctors trust that decision? Many AI models operate as black boxes, delivering results without explaining the reasoning behind them. This opacity can erode trust and make it challenging for healthcare providers to justify their decisions to patients, regulators, or even themselves. Transparency is not just a technical issue, it's an ethical imperative. Patients have the right to understand how decisions about their health are being made. If an AI system recommends a particular course of treatment, individuals deserve to know the factors that influence that recommendation. This need for explainability is even more acute in healthcare, where decisions can have profound, life-altering consequences. Thus, developers and clinicians must strive for AI systems that are not only accurate, but also interpretable. Another ethical concern is the risk of algorithmic bias. AI systems are only as good as the data they are trained on. If the data reflects historical biases or is unrepresentative of certain populations, the AI may perpetuate or even amplify existing inequalities. For example, if a diagnostic tool is trained mostly on data from one demographic group, it may perform less accurately for others, leading to misdiagnoses or unequal treatment. This is particularly troubling in healthcare, where disparities in outcomes can already be stark along lines of race, gender, socioeconomic status, and geography. To mitigate these risks, it is crucial to ensure that training data is diverse and representative. Ongoing monitoring and evaluation are also necessary to detect and correct any biases that emerge over time. Importantly, this is not just a technical challenge, but a societal one. Addressing bias in AI requires a commitment to equity and justice, involving input from diverse stakeholders, including patients, clinicians, ethicists, and community leaders. Data privacy is another central ethical issue in the deployment of AI in healthcare. AI systems often require access to large amounts of personal health information to function effectively. This data can include sensitive details about a person's medical history, genetic makeup, or lifestyle. Safeguarding this information is paramount to maintaining patient trust and complying with legal requirements. However, the more data that is collected and shared, the greater the risk of breaches or misuse. Unauthorized access to health data can lead to discrimination, stigmatization, or financial harm. It is essential to have robust safeguards in place, including encryption, de-identification, and strict access controls. Patients should have clear information about how their data will be used and the ability to consent, or not, to its inclusion in AI training sets. Transparency about data practices and a strong commitment to confidentiality are non-negotiable in the ethical use of AI in healthcare. The integration of AI also challenges our understanding of the human touch in medicine. Healthcare is not just a technical discipline, it is fundamentally relational. The bond between provider and patient is built on empathy, trust, and communication. While AI can augment clinicians' abilities, it cannot replicate the nuanced understanding and compassion that human caregivers offer. There is a risk that over-reliance on technology could depersonalize care, turning patients into data points rather than individuals with unique needs and experiences. Striking the right balance between technological innovation and human-centered care is crucial. AI should be viewed as a tool to support, not replace, the clinician's expertise and judgment. In fact, the most effective healthcare systems will likely be those that find ways for AI to enhance, rather than diminish, the human elements of care. For example, by automating routine tasks or streamlining administrative work, AI can free up clinicians to spend more time with their patients, fostering deeper relationships and better outcomes. Accountability is another key ethical consideration. When an AI system makes a mistake, who is responsible? The developer, the clinician, or the institution? Clear lines of accountability are needed to ensure that errors are addressed and to maintain trust in the healthcare system. Regulatory frameworks must evolve to keep pace with technological change, establishing standards for safety, efficacy, and oversight. This includes processes for validating AI tools before they are deployed, as well as mechanisms for monitoring their performance in real-world settings. Moreover, as AI becomes more integrated into healthcare, there is a risk of widening the digital divide. Not all patients or healthcare systems have equal access to the latest technologies. Rural areas or underfunded clinics may lack the infrastructure needed to implement AI tools, potentially exacerbating existing disparities in care. Ensuring equitable access to AI-driven healthcare requires proactive policy measures, investment in infrastructure, and a commitment to social justice. In addition to these concerns, there are questions about consent and autonomy. Patients must have control over their health information and the decisions made about their care. Informed consent becomes more complex when AI is involved, as patients may not fully understand how the technology works or the implications of its use. Clinicians have an ethical obligation to communicate clearly and ensure that patients are truly informed participants in their own healthcare journeys. The integration of AI in healthcare also raises philosophical questions about the nature of medical decision-making. Traditionally, clinicians have relied on a combination of scientific knowledge, clinical experience, and personal judgment. AI introduces a new dimension, one that is data-driven, probabilistic, and often non-intuitive. How should clinicians weigh the recommendations of an AI system against their own expertise or the preferences of their patients? Navigating these questions requires humility, reflection, and ongoing dialogue within the medical community. As we contemplate the future of medicine in an AI-driven world, it is important to recognize that technology is not inherently good or bad. Its impact depends on how it is designed, implemented, and governed. The ethical challenges posed by AI in healthcare are complex, but they are not insurmountable. By fostering a culture of transparency, accountability, and inclusivity, we can harness the benefits of AI while minimizing its risks. Collaboration is key. Developers, clinicians, patients, regulators, and ethicists must work together to establish ethical guidelines and best practices. Open dialogue and continuous learning will be essential as new challenges emerge and technologies evolve. Importantly, the voices of patients and marginalized communities must be at the center of these conversations, ensuring that AI serves the needs of all, not just a privileged few. Education is also crucial. Clinicians need training to understand how AI tools work, their limitations, and how to integrate them thoughtfully into practice. Patients, too, should be empowered with information about the role of AI in their care, so they can make informed choices and advocate for themselves. Looking ahead, the promise of AI in healthcare is undeniable. It has the potential to revolutionize diagnosis, treatment, and patient care, making medicine more precise, efficient, and accessible. But realizing this potential will require careful attention to ethical principles. We must be vigilant against bias, zealous in our protection of privacy, and unwavering in our commitment to the human touch that lies at the heart of healing. The journey toward ethical AI in healthcare is ongoing, It is a path marked by both opportunity and responsibility. By approaching this challenge with wisdom, compassion, and a deep respect for human dignity, we can build a future where technology and humanity work hand in hand to advance the well-being of all. As we move forward, let us continue to question, to listen, and to learn, ensuring that the future of medicine is not only smarter, but also more just, compassionate, and humane. Thanks for sticking around. Don't forget to subscribe us and check out therapyandrelaxation.com for more. See you tomorrow.